Hello everyone, I'm Dr. Barry Swindler. I'm a chiropractor in Wake Forest, North Carolina. I'm here today to talk to you about carpal tunnel syndrome. Carpal tunnel is probably one of the most common conditions why people would seek a chiropractor for treatment of carpal tunnel. Carpal tunnel is associated with repetitive stress injuries such as mail handlers that are constantly sorting mail, people that sit at an office all day and type. These are repetitive stress injuries. Also people in car accidents. I treat quite a bit of car accident people to where actually when they brace themselves from the accident, they're actually injuring their wrist. This is a condition that I treat successfully in my office, and I do this by evaluating the wrist and knowing that the one nerve that's involved is the median nerve. The median nerve runs down the arm into the wrist, and it's one of the nerves that supplies nerve supply to the hand. The median nerve supplies the thumb, the index, the middle finger, and half of the ring finger. The medical approach to treating carpal tunnel syndrome is most oftentimes with anti-inflammatory drugs. They sometimes put a brace. You may have seen someone that had a wrist brace on. If that doesn't work, they're left going to surgery. What surgery does is they will actually clip this band that goes around the wrist. It's like a big rubber band, if you will, and that is called a retinaculum, but it holds the 8 carpal bones that are in the wrist. So you have 2 rows of 4 bones, and that holds those wrists together. What they'll do is they'll go in and cut that, which relieves the pressure off the nerve. Well, that leaves you with a wrist that's unstable and can lead to degeneration down the road. One of the common orthopedic tests I do in my office, and many doctors do, is called the Phalen's test. And I'll have a person bring their elbows up about chest level and bring their wrists back to back and just hold that for about a minute. If the patient is experiencing any pain, numbness, or loss of feeling, that's a classic diagnosis for carpal tunnel syndrome. In my office, what I do to treat carpal tunnel is I evaluate the muscles, both the wrist flexors and the wrist extensors. And also I adjust one of the main bones in the wrist needs to be adjusted, and that's the one that's putting the pressure on the nerve. I'm an applied kinesiology chiropractor. This is one of the techniques I use, and applied kinesiology has to do with muscle testing. And what is happening here, if people have repetitive stress, they are causing rapid firing of the muscles in the wrist. The tunnel, the carpal tunnel, which puts pressure on the nerve. There are trigger points in these muscles that I find. I work them as well, do trigger point therapy on them. There could be weak muscles involved with the wrist, and I do a lot of muscle testing, and when I find a weak muscle, I find out what's going to make that muscle strong again to help support the wrist. And this is an approach I take throughout the whole body. But anytime you have muscle dysfunction, it is going to lead to joint degeneration, which leads to pain. And that's worthy of me repeating again, and I will, because I want you to understand that. It's a very simple concept, and that is if you have muscle dysfunction, muscle weakness, it is going to lead to joint degeneration, which is going to lead to pain. Very commonly I see this in whiplash patients where they have weak neck flexors. This allows the joints in the vertebra, the joints in the neck, to degenerate, which puts pressure on the nerve, and that gives you pain. So it's worthy of a doctor to take the extra time to spend with the patient to figure out where the muscle imbalances are and correct them. And that is one reason why a person would seek care at my office, because I'm going to evaluate the muscles. I do adjust just about every bone in the body, but we also want to make sure that the muscles are working, so it is supporting those joints. One of my goals of treating carpal tunnel syndrome is to help the patient avoid surgery at all costs. I don't think anyone enjoys having surgery unless it absolutely has to happen. Avoiding surgery, avoiding continual taking of anti-inflammatory drugs. They do help initially, but they're going to end up causing liver congestion and health problems down the road. And also the brace that you see people wear that helps restrict the wrist. Treating the carpal tunnel syndrome successfully helps to avoid those 3 things. There is a correlation clinically I want to mention here about blood sugar handling problems that is associated with carpal tunnel syndrome to people that have carbohydrate intolerance and also insulin resistance. And we can talk about diabetes here, or low blood sugar, hypoglycemia, whatever you want to call it. This is found with carpal tunnel syndrome, and I do evaluate blood sugar handling problems with all my patients. This is Dr. Barry Swindler. Thank you for viewing in on my carpal tunnel syndrome presentation here. You can contact me at 919-349-9413. I am located in Wake Forest, next to the license plate agency off South Main Street. You can also find me on my blog at chiropractorwakeforest.com. Thank you.